Hi, and welcome to Rogers TV's special COVID-19 program. I'm David Shearman. My guest is Dr. Arra, who is the Medical Officer of Health for Grey Bruce. But before I talk to Dr. Arra, I want to express my appreciation to those of you who have participated in the Hearts and Smiles campaign that Rogers has been a part of over the last week. This started on Tuesday and was a special fundraising effort involving all of Rogers Media and all of Rogers properties. And it was basically, we were offering special t-shirts and special face masks. And you can see as I slide back here, this is the special Rogers t-shirt. However, so many people bought these t-shirts that Rogers has been able to raise over $1 million in 4 days. And the purpose of this is money which will go to hospital foundations for PPE, of course, and for education and support for those who are frontline workers. And a portion will go to Indigenous and territorial healthcare services as well. So thank you. This effort will continue, and you just need to go to heartsandsmiles.ca for more information. But it's been a great effort, and hey, I like the t-shirt. It's a good one. Dr. Arra, welcome. Good to have you back again.
Always good to be here.
Now, this has been how should I say it, an eventful week. We've had lots of changes, lots of new things come to the fore. We're almost, in some ways, it feels like the beginning again, because there's so much change that's happening. And just before we went to air, you said it's been a crazy day, and I'm sure it has. But I wanted to focus on a couple of items today before we got more specific. And the first is face masks. The messaging seems to have changed. It's moved from they're not necessary or don't worry about it to, well, what did you say?
Well, the recommendation change, rightly so, depending on the level of risk in the community and the level of robustness of the social distancing recommendation. So if we go to basics, a face mask, a mask used to protect the person from getting the disease in the healthcare system, if you use it in public, if you use it by any one of us, not in a healthcare setting where there is a protocol to use it, to put it on, to take it off, there is benefit in protecting the person that is countered by harm related to the frequency of touching our face and the way a person would put it on, put it off, take it off if they're not trained to do so. And if you put it for a long period of time, the whole day or a few hours versus for a clinical procedure, the benefit is countered with the potential harm of all these factors. So there is really no benefit to protect the person wearing the mask. There is always a benefit of protecting people around the person wearing a mask. So if there is social distancing robust enough to have people in their homes, like it has been for a few weeks, wearing a mask in this setting is futile. It's not going to add any benefit. So with this in mind, we go back to the time frame that this outbreak has developed. In January, February, March, there was no community spread. So there is no benefit of wearing a mask to protect other people from the no existence of virus. Or if there is some protection, it is minimal. And I will circle back to this idea of should we implement it for complete measures early on. So that's January, February, March. There was no enough circulation and risk of transmission in the community to justify using a mask in a public setting. In April there was, but we had the social distancing robust measures in place. Now we're heading into reopening stages, and now there's going to be potentially more risk of transmission because it's community spread, but we are having more contact with other people. We're in spaces that would require us to have it.
Okay.
So if I may, there are 2 points there. The one I want to circle back to, if we implement these measures early on in January, guaranteed in 2 months, people will be fatigued by this measure and they will be fatigued by the messaging about it. So it's important to hold back until it is very useful and necessary to have it. And this would be the appropriate time. The other part of the equation is if we implemented these measures and we were not we were not successful in communication with everybody around the table to do the right thing, it might even make it more complex to issue any recommendations down the road, that it would lower the trust and the credibility in the benefit of the recommendation. So all in all, you put it together, this is the right time to do it. And it is very important, that's a final point I wanted to mention. Face masks are in public are not replacement of social distancing. They are to augment social distancing. They will be very useful if social distancing is not feasible. If a person is in a retail store and there isn't 2-meter space for a person to be from somebody else. So in that context, having that extra layer of protection will be helpful. And that's why the recommendation currently to move to doing this.
So it's directly related to the release of the new directives, which allow for retail opening, which will come next week, and as well as other less, as we move forward into the next phases. So just to be clear, you don't have to be wearing an N95 mask. A homemade mask is quite acceptable, as is a light commercial type that simply loops over the ears. You don't need to. I actually have seen people wearing not just full N95 masks, but full hazmat suits while grocery shopping. Now, this was early on, but it was quite remarkable to see. I didn't quite expect to see that, but none of that is necessary. A simple face mask to cover your nose and your mouth is sufficient. Is that correct?
That is very correct, and this is a really important point. Even in the messaging we have and the ministry had, we shied away from using the word mask. We used facial covering, face covering, to convey that message clear to the public. Any item or product, homemade or purchased online, is as good as a surgical mask in a public setting. So it is probably important for all of us to preserve that resource, the product, the surgical mask, for use in a clinical world where it is most needed. And I've seen people make their own masks, and some of them are quite appealing to put on whether there is an outbreak or not.
Yes, I think this will be the new fashion statement. In fact, I was reading in the newspaper today that some of the high-end fashion outlets are creating designer masks, and we can expect that, as well as just I'm sure, the dollar store types at the lower end of the spectrum too. Before we move away from this, I also wanted to just speak to you about the other change that has happened, and that is the question of your S-22 order, which closed all of our beaches. What was behind all of that, Dr. Arra?
Certainly. If I may, before leaving that subject, the final point about masks, we might see in the immediate future people not disposing these masks properly in the garbage. They might be left on benches. It is important for all of us to know that littering these items is actually dangerous. So I would just remind people to do the right thing and ensure it is in the garbage. Related to beach closure, it is a public health intervention geared to doing few things. One of them is to protect the public, whether local or visitor, to lower the risk of transmission of disease. And it is directly related to the reopening stages. And this might not become intuitive for a person. So I'll be more than happy to walk our audience through this.
By all means, go ahead.
The background of the order is the fact that we have very relatively positive results in Grey Bruce. We have 0 death, and we have 0 hospitalization. And this is really again, relatively positive. There was nothing positive about COVID, but comparing to other areas in the province, we have a total of long-term care outbreaks that we managed to declare 2 of them over, and the other 2 will be declared over soon, with a total of 3 patients in the last remaining 2 outbreaks. So this is really good result. And it didn't happen by coincidence. It is directly related to 2 efforts: the public's effort and compliance with the recommendation, and the public health effort to do what we do really well, keeping healthy people healthy. So if we had many cases and they end up in the hospital, the healthcare system will take care of that. But we've been successful in Grey Bruce to do it through public health, keeping healthy people healthy. And it is the public that did the heavy lifting of ensuring optimal compliance. So I look at this population that we have, and I look at the coming few weeks, and that's where we need to do the proper management of emergency and instead of being reactive. It is always the best practice to be proactive. And we look at our locality. We have a population of 166,000, and over the summer months, we receive over 2 million visitors on any year. That's spread over the summer. So we do the math, our population usually doubles. So we know that our population did the right thing. And I look at this population divided into 3 subpopulations: residents, cottagers, and one-day visitors. The residents and cottagers are part of our social fabric. And we have this situation in Grey Bruce that this is our reality. Some people live 12 months, some people live 6 months. And we know that the first subpopulation, residents, received appropriate communication and recommendation from public health and utilized it, and the numbers speak to it. We know that the second subpopulation there's no reason they would not do the same thing. Most of the cottagers that already arrived have not had the disease, and the cases speak to it. So they are following the recommendation, which is great. And the people who would still to arrive, within 2 weeks of directed messaging, they will come up to speed to, if they didn't have the same speed or better recommendation from wherever they came from. So these 2 subpopulation, when they require information, we provide it, and we know that they're doing the right thing. The third subpopulation, one-day visitor, by definition, they come for 1 day. And most people will go to the beach, and the last thing a person want to do on the beach is to check the health unit's website or listen to me talking on the radio. So it will be close to impossible to convey the recommendation that's required at the time. And this recommendation would change on every 2-3 weeks. And if we, by a miracle, reach this subpopulation, the one-day visitor, by definition, tomorrow, they're not going to be here. So how can we implement a public health measure to ensure non-necessary travel is there? Closing beaches to our area would mean a person who's arriving here would have no place to go other than sitting in their vehicle. If we convey it through the media, through an order of thumb wage that will be augmented by media, it will go to the bigger cities, and so far it has been the case. And hopefully we can protect both our residents, cottagers, and the visitors themselves from coming to a situation where you would find 3,000 people on a beach. And again, I started by how is this in line with the reopening? And this is the link to it. If we will have, let's say, 20, 30,000 people on beaches on long weekends or in general coming to Grey Bruce, there is inherent amount of risk of transmission of the disease with this big number. I much rather 30,000 people going back to work in Grey Bruce, and the inherent risk in that is controllable and probably is less than people aggregating on a beach. So in this case, let's open our economy in the sectors that we see best fitting to support our local economy. Family business, small business is the heart of Grey Bruce and our economy, and people are eager to go back to work. And the goal in the reopening is to let people go back to work, like put them in the engine that's producing economy, for our local need. So looking at the two, visitors who would come would bring economy, no question. I'm not an economist in any way, but I know that the risk of transmission with sending 30 people to work is less than the risk transmission of sending 30 people to the beach. And which one is essential? The answer is really easy. So all in all, it is timely with the reopening to close the beaches. And our goal is not to prevent people, locals, cottagers, or residents from walking on the beach. It's not. It will be tight for the first period of time, could be a week or two. We assess the number of cases and we reduce or modify the order or rescind it altogether if we see that it has been successful in what it was designed to do. So I hope that will provide some clarity about the background of that order.
That's actually also suggests that your comment about that this is a temporary thing. It will be reassessed. It's a good way of looking at it. But I also wanted to ask you, are you the only MOH across the province that has issued an order like this, or are your colleagues in other health units doing similar orders, or are they also closing beaches in other areas?
So for beach closures, all beach closures in the health unit, it is the only order in the province that I'm aware of. And, it's a small group of specialists, 34 MOHs. So there is no other MOH who did this. There are MOHs who ordered far stringent orders to ask cottagers not to come to their cottage altogether. And that might be the right thing to be done in their area. I don't want to comment in details. There's a lot of thoughts that were put into that order, I am sure. But for our area, I don't see a benefit in restricting people from to that degree. There is a principle, David, in public health is the least intrusive. If something could be done through education, that's better than warning, that's better than an order. And if an order is needed, it's an order that's limited to 2 weeks and certain activities, not orders that are directed to individuals to basically take their liberty and their access to their property. So again, although it's an order that went from the MOH office to the municipalities, and it's designed to close beaches, it is by many criteria least intrusive.
Well, thank you for that clarification, Dr. Arra. I think this has been really helpful in making sure that people understand the why, but also the what around the order. And the fact that all of this is very, very fluid, very flexible, and we will just have to wait and see. I remember many years ago some advice I received from, believe it or not, a tour guide who, when a bunch of us were getting a little rambunctious, he just looked at us and said, "Have patience, have patience." And that's good advice in today's world as well. I think we're getting close to our time, Dr. Arra, so I want to thank you for sharing these insights and explanations with about both masks and your order on beaches. And we will be back again probably next week. And I'm quite sure more news and more information about COVID-19. Thank you again for your time, and all the best to your staff and to yourself.
Thank you.